Hey everybody, it's Dr. Sarah from Core Health Chiropractic, and I am so excited to be sharing the screen today with Dr. Dan McClimon. Dr. Dan and I go back a very long time. We actually graduated chiropractic school around the same time. Dr. Dan and his wife, Megan, started their chiropractic practice right before ours in Montgomery County, so we're neighbors. They have grown a really beautiful family holistic practice. They added SoftWave about 3 years ago and a whole bunch of other really amazing therapies to their lineup. So when I started learning about SoftWave, who I started getting my information from was Dr. Dan. Dr. Dan has been progressing SoftWave in the US with doctors, DOs, OBs, the whole gamut of providers speaking and mentoring people around the country. And I'm so excited that I can call my friend, but also that he is supporting us in our community. And I just wanted to share some time with him and ask him some questions so that we can get more clarity and for our community. So Dan, thank you so much for hanging with me today.
Yeah, really excited. It's, such an amazing thing. And, we're just really looking forward to spreading it and helping more people get access to it.
Yeah, I'm so excited. We've been really excited. We've been seeing amazing things, and I've loved watching you grow and watching you really help your community members in your practice, which has been amazing and such a blessing. So tell me, like, why do you love Softwave, and how did you get into it?
Yeah, with SoftWave, it's one of those things where it's such an amazing thing and it's been around for a while, especially over in Austria and Germany and in Brazil and South America. But a lot of people just don't know about it. It's been in the States for about a decade. But a lot of the people who have access to it are, celebrities and pro and Olympic athletes and, a lot of big names. Like it's amazing, but most people don't know. And the reason why I love it is because, it helps the people who are dealing with so many common things, joint degeneration in the knees, shoulders, low back, hips, disc issues, plantar fasciitis, all this stuff, and they want to avoid more medications, injections, surgeries, joint replacements, but they just don't know what else to do. They don't know that this is available to them. And this is a non-invasive, conservative, natural way to clear damaged tissue and bring your body's own resident stem cells to the area to start to regenerate and repair new healthy tissue. And it helps people avoid the progression of those conditions leading to more invasive stuff. So, like we take care of our own family, my parents, brothers, aunts, uncles, like my wife, my team, myself, plus all of our community members, and I just really get excited about, helping people learn about this because, it helps people avoid more of the stuff that they don't want, the more invasive things. Sometimes you need that stuff, but that's more of a last resort. If it's there, if it's needed, I'm thankful. But, now we have this tool and I could go on, but one thing I want to say is, a lot of the surgeons that I work with, they tell me that they're doing less and less surgery and more soft wave tissue regeneration just because of how it works so well.
That is so cool. And
Yeah.
I know I've been training, alongside you and with you've been mentoring me and our team. But I love to explain soft wave. It's so interesting because it's unlike anything that we've ever been able to utilize. It's not like stim, it's not like ultrasound. But can you explain like what is soft wave?
Yeah, for sure. So soft wave, it's a special type of acoustic wave or sound wave. And if you know about, what's called lithotripsy that's used to break up a kidney stone, it's the same type of technology, except instead of being very focused like that, this is broadly focused. So what happens is that the sound wave travels very fast through the tissue and over healthy tissue, you don't feel it. But when it finds damaged tissue, you're going to feel it. You'll know where that damaged tissue is. So just that feature alone of it allows it to be what we call a diagnostic tool. We can tell where there's damaged tissue and then where there's healthy tissue. So a lot of the pro athletes, they use it as a screening tool, whether they have pain or symptoms or not. They do it on a monthly basis just to check if there's damaged tissue. So the way that it works is when the sound waves go through the tissue, it does three things right away. The first is it clears what's called senescent cells, which are dead cells, damaged tissue, scar tissue, adhesions, all the roughness there. Clears the damaged tissue, brings in blood flow, and it helps to modulate the inflammatory process, which just means people after the first session, about 3/4 of people or more will feel like it's looser, lighter, more lubricated, less pain, easier range of motion after one session. We've had people with problems for 20, 25, 30 years, with their knees or back, get one session and be able to move like they haven't moved in decades. And there's tears and just their emotions. And it's amazing. But that's not why we have these machines. That's a blessing and it helps so many people. But the reason why we have them is because of what happens next, which is after that immediate response, it initiates a cascade of the healing process where your local stem cells are activated. Say we're working on a knee, it activates the local stem cells around that knee tissue and it causes resident stem cell migration, meaning that the stem cells from the bone marrow will migrate to the area of damaged tissue where they can then go to work to repair damaged tissue and regenerate new healthy tissue. So I call it going on offense. We don't just want to slow down degeneration and, slow that process while it's getting worse. We want to stop it and then go on offense. We have to regenerate as much tissue as we can. We call it extending your warranty, getting more mileage out of, your knees, shoulders, back, hips, whatever. But that's basically how it works. And that stem cell migration and regeneration of tissue will happen for months, up to 6 to even 10 months, according to some studies, after you do the session.
That's so cool. I know it's like amazing. And if you're part of our community, you don't know, stem cells are so cool because they can become anything. They can become any cell in your body. And they're very, very special. So that's really cool. I don't think I've never seen anything like that where it's been able to trigger stem cell migration without some type of injection or invasive technology or very costly procedure that you have to, for us, travel pretty far for. So that's one reason why we became really excited about it. So I know who's walking in my door, but who do you typically see? Like who's coming to your office for SoftWave sessions typically?
Yeah, it's amazing, because we run a chiropractic practice and take just like you guys and take care of, all kinds of people, all walks of life, all ages. And a lot of the people that we just see on a regular basis and their friends and families and loved ones, they have issues with, here's the most common things. The knees, so knee degeneration or injuries, old injuries, bone on bone degeneration, trying to avoid knee replacement. But then the same thing with the shoulder and rotator cuff issues and degeneration in the shoulder joint, frozen shoulder, limited range of motion. And then one of the next most common is the low back and hips. So like those SI sacroiliac joints, they're in the low back and actually the ball and socket hip joint. And then we see a lot of neuropathy, so peripheral neuropathy, a lot of plantar fasciitis. So those are the most common things, but also I would say, really the joints. So, your elbows, wrists, and hands and fingers and grip and all that stuff, your arthritis in there. And then the ankles and feet as well. We see all of those things, and I could tell you lots of stories about them, but they're the main things. I will say that, the SoftWave technology is being used for indications or things far beyond the joints. I mean, they do it over organ tissue and the heart and liver tissue to regenerate. They do a lot of these things overseas. They do it after COVID on the lung fields to clear the lung fields. They're doing it on the brain to help with memory loss and dementia. And there's, a lot of research being done. But in our practice, those things that I mentioned are what we see every day.
It's so cool. Maybe you find this too with your practice members, but I've had a few people come in for their initial mapping session. They really enjoyed it. We're moving forward with our care, but then they do a lot of research and then they're like, hey, can we work on digestion or does this work on skin or like hair loss? Like, so it's really interesting. And I'm actually finding maybe you find this too, but my practice members, like people in our community are like, giving me more information, and I'm like, oh wow, like I'm so in my zone of looking at what I'm looking at that there's so much that's like been really, really cool. So I love like the engagement of research that we've been having with people in our community, because I think once you know more, you can take, better advantage of that, but also like the sharing information, which is cool. So I love that. So I mean, we're both healthcare providers, and we've been in this for a long time. And I think one of the best parts of being a provider, especially a family provider, is sharing stories. And I love sharing our chiropractic stories when we work with our kiddos and adults. But for us, I wanted to share, and I would love if you could share. Just we've been doing it for such a short amount of time, but Dr. Dan has been doing SoftWave for a lot of years, actually. So I'll share maybe one of my favorite testimonial stories, and maybe you can share some of yours.
Sure.
So I'll go first. So, and this, I share this a lot, and I share this with you already, Dr. Dan, but the reason why we were looking into SoftWave and then invested with it inside our practice was because of Dr. Jason, my husband, with his plantar fasciitis. Plantar fasciitis is like so hard to treat, especially when you're on your feet a ton. And he is, if you've ever seen him in our practice, that guy is running around like crazy. And we had tried a lot of things, all conservative things, and then even 2 injections. And they just were really not moving the needle where we wanted them to be. So he started going to a colleague. He started getting some SoftWave, and it really started helping. And even now, when we have some flare-ups, we really start to build in the maintenance part of where he's at. Now, before, when he was having this huge flare-up of plantar fasciitis, he couldn't walk, he couldn't run. And I reached out to you, and you're like, yes, I think this can help him. He couldn't get our kids anything at the end of the night. It was really, I mean, he did, but it was super painful to get off the couch at the end of the night. Waking up in the morning was horrible. Walking the dog was really a challenge. So really functionally was affecting the way we were inside our family. So now he can do all these things. He can go for a run. You see him running around here. So that's been awesome for our family. But another huge testimonial I found is someone, and we're new at this, and we're really learning and changing as we're introducing this to our community. But one really cool one was someone who is suffering with neuropathy in the middle of cancer treatments, and she's getting a lot of relief in between her sessions. But we know we're building those bridges back to healing those nerves after they've been damaged from the drugs that she needs to be taking right now. So that's been really cool. So those are mine. So those are some big wins over here, and it's been awesome to see. So tell me, what are some of your favorite testimonials that you've seen with your people?
Yeah, so I would say the first one is my uncle, and he woke up one day and he's in his 60s and he couldn't use his left arm. He couldn't grip the silverware, cut a piece of meat. They thought he had a stroke. They didn't know what was going on. And so he had all this testing done. And, long story short, they wanted him to go to the neurosurgeon and have a consult to have surgery on his neck. And I say, hey, Uncle Dom, you got to get in and let me check you out. We're going to figure out what's going on and just see. Long story short, I checked him out, did some imaging, all that, and it looked like there was a significant issue in his lower neck and shoulder. So, we got him adjusted, and then we did SoftWave on his neck and shoulder, and then eventually down to his elbow and wrist and hand. And after one session, he was 75% better. Couldn't believe it, was blown away. After 3 or 4 sessions, he was like 80, 90% better. I mean, he was full function regained. And, he couldn't move it like he wanted to. He couldn't grip it. And he was about to go for a consult to have surgery on his spine. And so it took a few sessions, and that was a complete non-issue. And so that one's just really important because he's family, and it was so urgent, and like it felt like there was a lot of pressure, and you got to figure something out and go to the surgeon, and it would have been a totally different story for him. And another one is Frank. Frank's a great guy. We've taken care of him a long time, but he's always had this issue with his shoulders and raising his arms. He couldn't get them up above about here. Takes care of everybody, his whole family, grandkids, just a very selfless guy, nicest guy you'll ever meet. And he's gotten great results in a lot of areas of his health, but these shoulders just never improved. And so, he works over a microscope, has been for over 35 years at his job. And one session of SoftWave, Frank's a man of few words, but his face lit up, his eyes. when he picked his arms up and he said, I could touch my ear. I could touch my, and he reached over and he touched the ear on the other side of his head, and he could reach behind his back and put his belt through the loops, and just to see him so excited about that. And then, we see a lot of neuropathy as well. So there's a lot there, but I think another one that comes to mind is just, with the knees, men, women being able to get up and down out of a chair, up and down steps and not have to shuffle. And then also the hands. We have a lady where, she loves to garden, loves to cook and work at home on different projects. And she just had not been able to use her hands and grip and have any strength. And with about 6, 7 sessions, she was back to opening jars and working in the garden. And so just those things, and seeing people's joy come back because, like, hey, I can do what I love again, and I'm not concerned or worried about like needing to have surgeries and injections when they get these results.
Cool. That's so awesome. And I always like say once we add something new or we bring something in with something that we've needed or something that's really benefited our family and we want to share it. So it's so cool that you had such a personal experience and then also now get to share it with thousands of people in your community, which is awesome. So I don't want to take all of your time because you have Dr. Dan has beautiful little boys and runs a really, really busy practice. But I just figured we wrap up with like, what would you say if people, to our community, if they're kind of like interested, thinking about doing a mapping session, like what, share some wisdom with us.
Yeah. So listen, I'm glad you asked that. Here's what I always say in the practice, which is that we don't guess, we test. We need to know what's going on. And so, like I said, with the professional athletes who use that for screening, you're going to know they call that biofeedback. Your body is giving us feedback and giving you feedback on, is there damaged tissue or is there not? And if there is, where exactly is it? That all happens with using the SoftWave. So you can use it for that diagnostic function, but then also to get the benefits that we talked about for the actual tissue regeneration care. So, if you've got something going on, with anything that we talked about, your knees, your shoulders, hips, spinal degeneration, stenosis, plantar fasciitis, tendonitis, neuropathy, arthritis in the hands, neck issues, these kind of things, you need to get in and at least get checked and do a mapping session. So that's the whole thing. And I know, and I think you guys are doing it similar. Before we made it available to the public, and started running ads and, trying to just help everybody that we could in the public in our communities, we reserved spots for our current and past patients or practice members and their friends and families before, the device. There's one device. You can only use one, help one person at a time, so the scheduling can become a thing. So it's like, to be able to get first access and the most convenient scheduling, I always say, go ahead and not only you get in and get checked, but if you've got a husband or wife at home, you've got family members, maybe children, or athletes, whatever it is, injuries, or loved ones, friends from work or church, whoever it is, get in and get checked while you have the opportunity here and just experience the benefits. What you do from there is always your choice. But I think, when you can experience it for yourself and understand it and how it works, to be able to know that there is a solution, not for everybody, but for the large majority of people, they're able to avoid the more invasive medications, pain management, injections, surgeries, joint replacements. It's just an amazing thing. And so anyhow, if you haven't already, go ahead and let the team know there, that you want to get in for a mapping session. And don't forget about, again, your family and friends and loved ones, get them checked too. And so I just can't wait to hear about all the exciting stories that are going to come from this.
Yeah, we're so excited. Absolutely. Yeah, we are. We have one machine and we have myself and another team member running it. So we do have some limited availability, and that is how we're doing it, is for friends and family first. So if you haven't done that, if you're interested, let us know. You can call or text us, but we are so excited. Thank you so much, Dr. Dan, for your time. It was great talking to you, and we are so excited to be able to bring this to our community. Thanks, guys.
Awesome. Thanks, guys.
Bye.
Bye now.